please.
Thank you for the invitation. Thank you, Co-Medica. Thank you, Cesar. My topic is skin rejuvenation. And we'll start with my introduction. I'm working in Essen, which is the Midwest of Germany. And this is the team, well, the picture is not that new, but still the same team. I'm working there for more than 10 years with the Fotona laser. And I'm also doing LAHA training workshops in London, where we like to do hands-on workshops, so you don't get the settings just, but you can also do some treatments and get involved in the laser system. So the SV Dynamis, as you all know, has two wavelengths. We have the erbium YAG and the ND YAG. And for the erbium YAG, we know the highest absorption in water we find with this wavelength. And it's the most efficient ablation for skin resurfacing. And with the VSP technology from Fotona, we have the possibility to have different pulse width, so we can have a long pulse and short pulses. And we can set different energy densities, which is very important to control ablative treatments. So we have fluences up to 310 joules per square centimeters, up to 50 hertz, and different spot sizes up to 12 millimeter, depending on the handpiece. So this is just an overview about the pulse durations. I was speaking about the shortest pulse is the micro-short pulse. We find 100 microseconds, and we can go up to the extra long pulse, which is more than 1.5 milliseconds. So we have a wide range where we can pick from, just depending on what we want to achieve on the skin. The smooth mode is a very nice and very special thing from Fotona. We find 250 millisecond long pulse, which is actually long pulse, so 600 microseconds long pulses. So we find 6 impulses in one smooth mode pulse duration. So it's very good for, like we saw before, for tightening, vaginal tightening. We can do it intraoral for snoring. We can also do it around the eyes, which I will show you later on. And these are the different kinds of hand pieces you will find from Fotona, which is the full field, full beam, the patterned handpiece, like the PSO3, and the fractional handpiece we find with a scanner. Let's go to the skin resurfacing. So we know there are lots of side effects, and the skin resurfacing is not the easiest, it's more an advanced treatment. So we find lots of infections we can have, like a bacterial infection. Sometimes we see a contact dermatitis. This patient was taking her own aftercare, which was with herbs, and so she thought it was good before the treatment, so it must be good to take it after full ablative treatments, which wasn't, so she got this dermatitis afterwards. And what we also find is with the CO2 laser, we can have, if you do too much energy and use it on the skin, we find an ectropium like this guy has, and we sometimes find these kind of scarrings. The whole skin is really thick and hard, and we have a prolonged erythema and hypopigmentations. Actually, this patient was happy because she didn't see the scars anymore, but she didn't care about the structure of the skin. We as dermatologists, we would think, we don't want this, so we don't really want this kind of side effect. And then we have to think about education of the patients, where you see here, which is an artifact, so he did some more treatment on his skin after the laser treatment. So talking about the skin resurfacing, like we saw one picture of herpes labialis after the treatment, we always ask our patients when they come in and see us in the first visit, do you have any history of herpes? So when we do ablative treatments, we always get them antiviral medication like half an hour before the treatment, and they continue for 3 days. If you have patients with lots of hyperpigmentation. We do patch tests. We usually recommend to do it on the same spot you want to treat the whole face, maybe. So you don't recommend to do it on the arm, same area, same things we would see after the treatment. So we want an even look. I would show you lots of pictures. So even if you don't understand English very well, you will see what I mean. So for whole skin resurfacings, we use Ambler cream for at least 1 hour before the treatment, or we have an anesthetist coming in the clinic and he works with us too. So again, this is the whole range of skin resurfacing, different settings, just depending on if you do a light peeling. So if you want to have a short pulse, you have possibilities. And you can also change the jewel, which is shown by this one. So you have 9 possible treatment options with the variable square pulse technique. So we have always to talk about expectations with our patients. So we want them to be happy after the treatment. We tell them it takes that many treatments and what they can expect from the treatments. So if you don't do this, they will never be happy. So the wish in aesthetic medicine is always to have no wrinkles, like you see on this face, this woman in years after the treatment, after aging. So this was age 23 and age 63. So that's what we want to treat, or we want to do with the laser system to help get back a little bit of the youth. So we all know in young skin we have no wrinkles, we have plenty of collagen and elastin. Whether they're in older skin, we see, just depending on the genetic or ethnic background or sun exposure time, we see the skin looks totally different. So we have lots of wrinkles and sagging skin. This is just a closer look on a wrinkle, which I think is a very nice picture. So the laser system, we can do ablative, we can do semi-ablative, and we can do sub or non-ablative treatments. Let's talk about the full beam, full face ablative treatments. So when we do this, we usually start working the first, well, let's say 2 to 4 passes with a short pulse, which is 300 microseconds. And we start to ablate layer by layer. So we want to create a defined dermal wound. And we want coagulation and also collagen shrinkage. So the results we see concerning the surface, the pigmentation, and the elasticity. So this is just an overview, and to give you a background of this, the depth of the wound, that it always corresponds with the number of passes you're doing on the face. This is how it looks like when you start with the patient, first pass, second pass, and this is how it looks like on the skin. So we want it even, and you can wipe it away after each treatment. We just wipe it away with a gauze, and then we continue with the next pass. So if you do a very superficial peeling, you will see this kind of whitish color. So you know you're intraepidermal. Then the yellowing color, we know we're getting deeper now, and we're getting to the superficial dermis, or even the deep epidermal layer. And whenever you see the pinpoint bleedings, we know we are getting close to where we want to be, which is the papillary dermis. So this is just on the cheeks, I would say about starting 200 micrometers depth. That's the scanner, the S-runner you can use for this kind of treatment. And as you can see, you can do what we can do as a practitioner. We can do coverage from 0, so we don't overlap, and we can do 30% overlapping, just depending on what you like, what you prefer. The most important thing is if you do a basic mode or you do turbo mode, which is, I will show you later. So the spot size is 4 millimeters with this handpiece, and it's going very fast up to 50 hertz. And this is how she looked directly after the treatment. So we wiped away with a gauze, and that's how it looks like. So we use, usually for the light peelings, just a hydration cream after that. So we don't want something too sticky on the skin. This is a patient we did a really full ablative laser treatment and more advanced techniques.
Could you say the parameters of this?
For this, I will show you. I have plenty more,
Okay.
so I will explain the parameters later. This is just when we talk to our patients in the first session, we tell them, well, whenever we want to make this line disappear, we don't need to treat just this area, but it's a whole area we have to treat when we do full ablative treatments. So that's why we have really large areas in the face we're treating for the full ablative. That's another example for the crow's feet. Yeah, same. We have a whole area we ablate fully. Another region is the periorbital region. This is not the first treatment option we would tell our patients, the full ablative treatment for this kind of treatments. So we rather do Botox, and maybe if she's still not happy, we can do this on top. But without Botox, it doesn't make any sense. So there's some settings. So we have the RO4 handpiece, full ablative, 2.6 to 2.8 joules, and we do multiple passes. There's no setting, actually. So you have to see what the skin looks like after each pass, and then you decide again, do I need another pass? Is everything smooth? So you get a feeling for the skin and how many passes you do. So if it's 5 or 7 passes, it doesn't matter. You have to look at the skin and see what you're doing. So this is a patient with an active acne. Before we start this kind of treatment, I just show the acne patient pictures because the treatment is the same as we would use for wrinkles or just skin rejuvenation. So before we start this kind of treatment, we look that the inflammation is gone. So we don't want the skin, which is intact, to reinfect from these kind of papules we see on the skin. So we did 2 full ablative treatments for this patient, and this is how it looked like 4 years after the treatment. It was fine. Another patient for the acne treatments, so that's how she looked before. We like to show these kind of pictures really to our patients who come with acne. And we tell them this is not one treatment, this is really 3 treatments or more, just depending on how deep these scars are actually. You can also, if you have less deep scars and just one is really picking in your eye, and you can do some biopsies. So how you call this? So you do like an operation for one big scar. You can sew it, and you can do it in one treatment. So it's one treatment for operation and ablative treatment in one session. So this is the local anesthesia we put on. We put them in a room, give some coffee or whatever they want, and they can wait for 1 hour in the clinic. So we make sure we have enough amla cream on, and when we start, we just wipe away the cream from one side, because if you do both sides, the anesthesia effect will be gone. So this is our technique of aftercare, which is the occlusive. This is wrong. Occlusive wound healing. We put some Vaseline with polyhexanate on the surface, and we put some cling film on top, and that's how she leaves the clinic after the treatment. This is another patient also with acne. So this is 10 days of downtime. You will see in the next picture. This is our anesthetist. And I put some settings also here. We vary in the spot size. If you have the whole face, we get bigger spot sizes. I like to work with 3 millimeter spot sizes and just raise the hairs. So it's actually the same then, just depending on what you like to work with. At least 3 passes. Maybe it's on one side it's more than that. So This is a follow-up after 1 day, 2 days. Then we remove the cling film after 2 days. She will come in the first day to the office and the second day, and then we leave the cling film away. And then after 6 days and after 10 days. So whenever the crusts are gone, we tell them you can put some makeup on and it's fine. Before and after again. Also, she had 3 treatments from this to this picture. So she had a combination of filler and also of full ablative treatment. This patient also, we just did 3 treatments of ablative. She didn't have any filler or something. That's one patient. She came in and she had a CO2 resurfacing somewhere else. And this is a typical thing, what we see. We see scars, we see erythema, and this is what we call milky mouth, which is a hypopigmentation, and the pigments won't come back usually. So this was half a year, I think, after the treatment. So another patient, we did the perioral region. This is the upper part of the face. We didn't do anything. With the low part, we did also full ablative. And this is a patient I did at the beginning of this year. She had these smoker lines, or whatever you want to call them, different names for that. This is how it looks after 1 day, after 7 days, and after 30 days. We tell the patients the chance that the wrinkles will come back is higher than in other areas you would treat for ablative treatments, because she always has the mimic. She won't stop the mimic. We can't educate the patient to not do this anymore. So maybe 2-3 years she will come back. It won't look like this, but it will be much more than the last picture I show here. So the disadvantage for full ablative, we all know the downtime is very high. The repolarization is 5 to 10 days. It's a bloody thing. You have crusts, you have swelling, but the effect is just enormous. You won't be able to do it just with fractional treatments. So the problem is we don't treat neck, décolleté, or the back of the hands. Yeah, that's what happens when 3 people come at the same time. From different treatment days. So fractional skin resurfacing. We use the fractional hand pieces. I just show real quick. PSO1, PSO2, PSO3. Different spot sizes you can choose. And same thing, antiviral test patches. And for this kind of treatment, for the fractional, we just use EMLA cream or topical anesthesia cream, whatever you want to choose. So the background of this is you produce an array of microscopic wounds, and it gets rapidly re-epithelialized, and it stimulates the fibroblasts, and for the patients it's much nicer because it doesn't hurt that much, and it heals up very quick. So the indications are sun-damaged, aging skin, fine lines, milder wrinkles, scars, stretch marks. Drug delivery is a big thing in our clinic also. We use it for actinic keratosis, so they come in, they get the treatment, and then we put the imicrimode directly on the skin, and then they continue the treatment at home for the next days. We do it for onychomycosis on the nail, and we put the ointment on directly, and for scars, for hypertrophic scars, we do it and put triamcinolone occlusive on top. And we know that for the kind of drug delivery, we just need to break down the epidermis, so that you don't need to go very deep for this. 100, 200 micrometers is fine, so you just get the medication through the skin. And also for laser treatments, but Stenko will tell you everything about it this afternoon, I think, so I skipped this one. So these are stamping hand pieces, depending on size. For scars, we recommend to just do 5 average. For skin rejuvenation, we take 10%. This is my favorite tool, which is the F22 scanner. it's in use most of the day. So we really love this. Same thing, coverage up to 20%. We never use 20% actually. 250 micrometer spot size you have with the fractional handpieces and with the scanner, so it's the same thing. So we can go deep as up to 1 millimeter with the fractional handpieces. So when we talk about turbo mode, which is T, whatever you choose, when we choose the short pulse, which we usually use in our clinic, we can say with a T2 you have a depth of at least 200 micrometers, and with a T3 it's 300 and so on. So what you need to know is that the thermal reaction in the tissue always stays the same. It doesn't matter how many pulse trains you do, stacking trains. So again, after you do this turbo mode, you have these really fine, accurately sharp defined microchannels, which is really nice with this laser system. More trauma leads to more effect. So if you have a short pulse, again, the thermal injury is less than if you take a long pulse. It's just an example of how the scanner works. Really fast, really fine. If you do scars, just easy. This is histology from just different settings. We did 30 joule here, and you have a depth of 800 micrometers, and with 60 joules you get down to 1,600 micrometers. But if you push the button on the display, it always shows you what depth you have for heat and what depth you're ablating. So you will find it on the display. This is just to show how it can really go up until 3 millimeters of depth, really in the subcutaneous tissue. That's an example of tattoo removal or permanent makeup removal we did in the clinic. We always use Q-switch first, then we use this fractional ablation, and then the Q-switch again. But this is just our technique. So just to show you, the downtime is completely different if you do full ablative treatments or fractional treatments. With the full ablative, we said 7 to 10 days. With the fractional, it's with the T2, mostly 4 days, and they are fine, they can go to work. This is how it looks like. Should be even to have a nice effect at the end. Now you're learning German also. So for this lady, she didn't have any anesthesia. So as you hear this, it hurts a little bit. And it was just before blepharoplasty. And then my boss just had done the blepharoplasty and sent the tissue to the histology, and we can see the differences. A little bit discomfort. Sure, yeah. FSO1, FSO2, FSO3, I think. Stenko. Am I right? You can use every stamping hand. Yes. So this is the histology afterwards. So you see the ablated pillar and the surrounding bridges from where the healing comes from. So that's nice to see. That's our histology in Bochum. It's in the university next door. So this is how it looked on our older system. So you can choose the turbo mode, whatever energy you want to use. We always use 10% for this kind of treatment. And this is how the patient looks like after the treatment. And turbo 3 is 300 microseconds, so 100 micrometers deeper, so it can be a little bit more bloody. But the healing time is fine too, it's 2 or 3 days more. So now you can see the pinpoint bleedings. This is after T2, you see 4 days and she's fine. This is one from our clinic, just to show you how even you can do the treatment. So we did the whole forehead with the short pulse, which is 300 microseconds. And this is, again, some patients after the fractional treatment. And this is a patient with scars, acne scars on the forehead. There we did some ablative parts, full ablative parts around the bigger scars. And then we did the whole area with a fractional, where we used the scanner, but fractional.
So, do you know the equivalence of these parameters with the R11? All of the users have R11, maybe? Could you approximate something?
For the full ablative, it's the
Le
same
pregunto
thing.
si puede
I think
aproximar esos parámetros a la R11, que es lo que casi todos vosotros tenéis, porque la R04 casi ya no lo tiene.
I think there shouldn't be a difference if you have the same spot size. It should be equally.
Vale.
But
Comenta que puede ser equivalente, no hay ningún problema.
I think on the display, it's always nice to see the red balcony which changes. So you know if you're taking not much energy, or if the balconies are red, you know you're at the end of the point. So I would stick to this, the visual background.
Perfect.
So this is just one treatment. Wound dressing, UV protection, and we want to reduce the inflammation. So now coming to the skin tightening. We talked about the smooth mode before. So it's a burst of non-ablative pulses, thermal effect with no ablation. I think the ablation starts at 6 joules, so it's a thing depending on how much energy you put in the smooth mode. Most of the time we used 2.5 joule to 4 joules in most of the treatments. We want heat depositing, number of passes about 3. You can have a little bit red bronze, so discoloration after this treatment, but usually after 2 or 3 days everything's fine. So this is just to give you an idea of the mechanism of action. Now talking about the PSO3, which is the fractionated handpieces. You see that if you do stacking pulses on the same area, the energy, temperature rises extremely after each shot. So after 3 shots, we have more than 50 degrees in the skin. Compared to the R11 handpiece, which is the full beam, you have to reduce the energy to get the same effect. As you can see, after 3 shots, you are at 60 degrees, which is much more. So you can also, I'm talking about, when I'm talking about the smooth mode treatment for the eyes, you can do it with the R04, but I would say almost half of the energy. So this is the PSO3 handpiece and the R11. They look totally the same, but if you have a look inside, you will see the array with the PSO3 handpiece. So we want the thermal coagulation. And we don't need any special pre-treatment for smooth mode on the skin. We recommend antiviral medication if we're working around the mouth. Cool air is recommended after the treatment. And anesthesia, yes or no, we always would say yes. If you have the treatment or do a spot size on your forearm, you will see you need anesthesia. I would say you need anesthesia for this kind of treatment if you use the same parameters. So we do 2 to 4 pulse trains on the same area, and in total 2 to 3 passes, and the angle of the handpiece should always be 90 degrees. So this is how it looks like on the skin. You have this nice visual feedback, these micro sub-ablative points. And we do it for the eyes, perioral, periorbital, and on the skin, on the cheeks, wherever you want to use it. I have some examples. So smooth eye is the only tightening you can do really around the eye. Same thing with the smooth lips. We don't want endiac, that's why we choose erbium smooth mode. It's very important. We don't use endiac around the eyes. So this is what we want to treat, this kind of sagging skin. Another picture is here. So this is really the area you want to treat. You can go as close as you want to. Just be aware of the hair, because this will not permanently be gone, but for the moment. For eye protection, if you want to treat the whole area, we recommend plastic eye shields. If we're just treating the upper region of the skin, like this area up here, we put wet gauze on top of the upper eyelid. This is my boss. First treatment we always do on ourselves, so to see if it's safe and to see what you have to explain for the treatment for the patients. So we used anesthesia before, and this is after 2 treatments. Another patient, 2 treatments, upper and lower eyelids. This is brand new. She was on our workshop a couple of weeks ago for the same treatment again, because she likes it so much. You get addicted to this kind of treatment, actually. 1 treatment, smooth mode, also around the eye. Very nice results, I think. And easy, fast. 15 minutes, patient treatment, anesthesia, half an hour, perfect.
Which are your standard parameters for this?
Like I said before, 2.5, 3 joule, and we do stacking passes of 3, and we do 2 to 3 passes and no overlapping to 5% overlapping. We don't want too much with this kind of setting.
And it's well tolerated? Well tolerated for the patient?
With anesthesia cream, yes. Without, no. And cooling afterwards, because you will have lots of swelling after this kind of treatment. This is, my eyes. So that's the conclusion: easy, non-invasive, skin tightening if you don't want blepharoplasty at the moment, or a brow lift. So, and the effect is similar to the FREC 3 treatment. So, but it's not only for the eye treatment. We did some arms, 3 treatments, 15 months later, and the other side again, same patient. But it takes a long time to do this whole area. So these are my settings. And the red bronze appearance I talked about. And we have a light peeling around the eye about 2 to 4 days later, but very, very slightly.
Very slightly.
Yeah.
The slide before, please. Repeat the slide. The previous one.
Previous one.
This one.
Thank you.
One more, please.
Thank you. You need another iPhone.
Uncontrolled skin. This is how it looks like in histology. We have 4.0 joule for the smooth, and you see these subablative areas. Compared to the fractional ablative, you see the epidermis is ablated. So we have what we achieve is we heat up the tissue up to 50 to 70 degrees, depending on the settings. We have up to 0.5 millimeter of heat depositing in the tissue, and we want the collagen shrinkage, the neocollagenesis, and the remodeling of the collagen. This is my brother. I treated him around the eye. We did a combination of only erbium YAG, which is the smooth mode, and the ablative in 1 session. He was a smoker, I have to admit, and during this time he quit smoking. May have helped also for not coming back again. Directly after the treatment, I did T2, so 200 micrometers depth. This is how it looks like after 2 weeks and after 7 months. Again, other side. Nice effect, I think, before and after 7 months. It's easy, it's fast, half an hour. So let's come to the ND-YAG now for skin tightening. The deepest penetration with the ND-YAG, that's why we don't use it around the eye area. Fluences, frequency, so with the scanner
Just
also.
1 minute.
How many?
1 minute.
Oh, okay. Same thing, force duration differently. We talked about this before. Different hand pieces. The small one, the R33, is for small sizes up to 10 millimeters, and the R34, 15 and 20 millimeter spot sizes. Jorge has talked about the matrix view, so I will skip that. Let's come to the skin rejuvenation. Absorption in hemoglobin. We know all this about the ND-YAG, how it works. We want photocollagen remodeling, and we want to stimulate the fibroblasts. FREC 3 we do for the whole face. this is a typical thing for the FREX 3, so it has 1 millisecond post duration, so very short. To not get confused in the clinic, I mean, this is the range you can put in. We always use 1 millisecond. This is how it looks like when you heat up the skin with a long pulse. So you don't have peak power energy. So what we have with the FREX 3 is really nice effect for skin tightening. Again, so this cross section, we get much higher temperature with the short pulses. We always say it's like heating up the raisins. That's where the energy gets into the skin, and from this it spreads into the tissue around. So we have a very large healing surface with the FREX 3, even more than we have with the ablative fractional beam. Again, with a very long pulse, the small particles in the skin have enough time to cool down, so we don't get the high peaks in the skin, which we have with a 1 millisecond pulse. So it's really nice for small absorption. This is really lots of energy. Just to compare, we are playing with lots of energy using the FREX 3. Just be aware of what you're doing on the skin. We don't want stacking pulses with the FREX 3. This is the temperature we want to achieve. So in our clinic, we did lots of treatments. Just be aware you would also reduce hair. It's the same wavelength for hair reduction. This is the first patient, one of the first patients before and after. Female, 45 years, 5 treatments. Really nice results. Some arms. This is a very nice protocol we did with this patient. It was also 2010, pre and post. The effect after almost 3, 4, 5 treatments. Really nice effect, this area. We have a lot of data on that. So these are my settings.
Let's stop there, please.
Yeah. My time is running.
What is sweeping mode?
I will show you. This is sweeping mode.
All right. Okay. Painting. Brushing.
I continue. Just to let you know, in this short time, we have a decrease of the energy, increase of 2, it doesn't show it, from 37 to 39. So what we want to do with the FREX 3 technique is we want to really train the fibroblasts to build new collagen. That's why we say we need more treatments, at least 3 a year. That's what we recommend. So it's coming to the piano mode, and I'm done in half a minute. Same thing we talked about before. We want to go deeper with the piano mode. This is the handpiece, our old handpiece. These are the settings I use for piano.
Only 100?
That's where we start. If you don't see, you always have to see, we want 43 degrees on the skin. If it's not enough, raise it to 110. We don't go higher than 110. Okay. And the most important thing is do small areas. If something is not working, you can't raise the energy on the field. Smaller areas, that's the main thing. Before and after, so we want 43 degrees, big spot size. This is how it looks after the treatment. Areas to be treated. This is 4D twin light sessions. We did 2 treatments with her, 3 on her, 4D, full 4D, what we learned before. And again, 2 treatments.
Really nice.
So we have positive effects that last. We know that it lasts for at least 1 year. As we say, the sessions we recommended 2 to 4 weeks, but now we see the results come later. So we say 4 to 8 weeks would be better if the patients come in then. We know we need more sessions with this kind of patients, and yeah, we all know. We would be happy if it was one of the treatment who did this side, but it wasn't. We all know this picture. This was a truck driver who had the side to the sun. So thank you very much.